So I'm going to talk today about pathways to translational research and medicine. I know a lot of you are interested in research careers. Many of you are interested in clinical-based careers. Some of you are even considering both the MD, PhD path. Um, we're going to talk a little bit about some other options that you might have. But what I really want to focus on today is whenever you make your decision about what your next step is, it's so important to make sure that you understand your priorities. What's important to you personally in your life? And not just now, but try to predict your priorities 5 years from now, 10 years from now. Things like, do I plan to have a family eventually? Do I plan to get married? Do I see myself getting married? Are you currently married with a family? So all these things are going to affect where your priorities lie. So everybody has their own priorities, but I've broken down priorities into 5 general areas: work, family, self, friends, and money. These are pretty broadly applicable to most people. So, what I want you to do is just take a minute and think about these priorities for yourself. If you want to write them down to have them so you can look at them later, please do, because I do think it's worthwhile to really take a minute and think about these things. If you can, even go as far as to rate them. What's the most important to you to what's the least important? And I think this is really important because as you make your decisions about your next step, you're going to want to keep those top priorities in mind and make sure that you're making decisions where you can really, take advantage of what you've already set for yourself. So when I was your age, my priorities were very different than they are now. I didn't have a family, I didn't have a partner. Work was number one for me. I worked very hard to get where I was as an undergrad. So that was number one. Family came first. I'm Native American Japanese, so family was always at the very top of my list. It was probably tied with work in a lot of ways, but that was always really important to me that I could always be there for my family and support them. Myself was way down on the list. I did not think that self care was a very important thing at the time. So I put myself last in everything that I did. As I went through my career, though, so just to give you a little bit of background about myself, I'm originally from Hawaii, from a tiny little village on the big island of Hawaii. There weren't a lot of opportunities for me to explore careers and to learn about what possibilities there were. I am first generation. Neither of my parents had graduated from college, so they insisted that I become a doctor, an MD. So I went through my high school, I went through my undergrad thinking that, okay, I'm going to be an MD. I have to do everything I need to do to make myself competitive. Part of that was getting involved in research. So I got accepted into an undergraduate research program, and that's where things completely changed for me. I loved research, decided that, I can see myself being really happy in this career path. Thinking back on my priorities, it gave me a lot of flexibility when you pursue the research path, graduate programs. It did give me the opportunity to travel. It gave me the flexibility to sort of pursue my other interests. I love art. I love being creative, and that's something that you can definitely take advantage of in a research career. So that was really appealing to me. So I went on to do my PhD at the University of Michigan, Ann Arbor. Got my PhD in cell and molecular biology. Was the best decision I ever made. And then I went on to teach. I continued to do research. And then eventually I ended up in Colorado, where I do more administrative work as the assistant dean. So I still get to use those research skills and trying to figure out how to best appeal to students, how to think about admissions in a very holistic way so that we're admitting the best students, not just the students with the best grades, but really good people. So that's the stuff that I work on now. I get to travel as part of my job. I get to be creative in creating materials and all these other different types of things to advertise our program. So it ended up being a really great career path for me. Throughout that whole process, though, I tried to keep my priorities in mind. I needed the flexibility. I knew that I eventually wanted to have a family if I could, and I wanted to be there for my family every single day. I wanted to be there at dinners when we got home. I wanted to be able to take my kids to their soccer games and have that flexibility to be able to do that, to take that time. So that was really important to me. Um, so take a minute, think about your priorities here just for a second. And what I also want you to do in the chat is I wanted to know a little bit about you. So in the chat, if you want to tell me what your career goal is, what are you thinking as sort of the next big step for you along your career path, that would be great. And it could be anything. It could be, I want to be an MD. I want to be a neurosurgeon. I want to get my PhD in a biomedical discipline. Or maybe you want to go a different route. Maybe you want to be, you want to get involved in business or in biotech. But I would love to know more about you. If you feel comfortable, feel free to pop it in the chat, sort of your next step, your goal. A lot of future clinicians here. All right, Jimmy. Jimmy, I feel like I've seen you at a lot of these presentations. Hopefully you're not tired of seeing me. PhD in teaching. Excellent. MD, PhD possibly. MD, MBA, says Natalie. Awesome. Thanks, Jimmy. Not sure. Helen, I love that. Not sure. Keeping those doors open. You're ready to figure it out. Okay. I'm gonna move on now. Go ahead if you're still thinking, you can go ahead and pop it in the chat. My first lesson for today. You have time. Don't feel like you have to jump into your next step right after your undergrad. For a lot of you who are headed towards medical school, it's possible you don't get in on the first cycle. Don't let that freak you out. It's very common. You have to reapply in a lot of cases, but have a backup plan. If you're not sure what you want to do something that allows you to take the time to figure that out. Some hands-on experiences, some internships, get a job that gives you the flexibility to do some volunteer work. If you have some ideas, take the time to do interviews of people who are in those career paths so you can learn more about what they do day to day. So I do want to stress that you definitely have a lot of time. For those of you who are taking 5 years to complete your undergrad, if you can afford that, that's great. You have that opportunity to take more courses to really sort of sample some of these other disciplines. So keep that in mind. Considering your options after your bachelor's. So once you've gone through college, I think a lot of you are sort of in that period of undergrad-ish. You might be coming to undergrad, you might be in the middle of it, you might be on your way out, but you do have some options after you get that bachelor's. You could be unemployed, which sounds bad, but it doesn't have to be bad. If you have the opportunity to have support from your family, to just travel, to do some volunteer work, if you are financially stable enough to take a little time for yourself to figure these things out, that's great. For some of you, you might be looking for jobs, or maybe you already have a job that you want to continue. And this could be really great for your next step if it's related to what you want to do. So internships, if it's a fellowship, if you're volunteering somewhere like in a lab or in a clinic, if you're taking the time to study for those exams. So if you're looking at medical school, definitely taking time to practice the MCAT, and then also getting to understand the CASPER exam and what that entails. That's definitely time well worth spent. For a lot of you, you are headed directly into your professional degrees, and that's fine. You know what you want to do, you're prepared, you spend a lot of time becoming the most competitive applicant that you can. Now, professional programs, these include things like medical school, dental school, physical therapy, nursing. It's a school that's training you to be something very specific. And then a lot of you might be headed to graduate school, and graduate school is very broad. We're talking about any master's program, any doctoral program that's research-based. That's what graduate school means, and it could be in any discipline. So professional programs, and this is where a lot of you are headed, like I said, they're training you to be something very specific. You go to medical school to be a clinician that practices medicine, human health. That's what you're helping people in that way. You go to nursing school to become a nurse, to work in the clinical setting. So the skills that you're developing are all very specific to the trade. There are some opportunities to diversify your training a little bit, especially now. More programs are building out different types of tracks, different opportunities to work in different settings. But for the most part, the skills that you're learning is for a very specific career. Graduate school is different. And if you've heard my talk before, I definitely stress this. Graduate school is not training you to be anything in particular. Graduate school can either help prepare you for your next step, it can teach you a new skill, it can be a stepping stone into a career. If you're looking at doctoral programs, yes, it's research based, but what they're training you to do is to think about problems in a critical way and develop the tools needed to solve those problems. So it really it helps you to think about things in more depth, and that's some great skills that I think anybody could benefit from. So when we talk about graduate programs, we talk about, like I said, the master's degrees, doctoral degrees, not necessarily medical doctorate, but the PhDs, EdDs, PsyDs. Those are all doctoral degrees that you go to graduate school for. And the nice thing is you can combine these degrees with others. So somebody wanted to be MD, MPH, that would be a graduate degree that you can combine with a professional degree. So master's programs. If you are thinking about a master's program, um, you already know that could be a stepping stone into your next step. If you are headed towards a professional program and you're thinking about backup plans, master's programs could be really, really great to consider. And it might not be something that you're considering now. So these programs can be stepping stones into a career in industry and really anything. It could be a stepping stone into a PhD program, into professional programs. Depending on what the degree is offering you, it can really help to strengthen your application to those research and to those professional programs. It could also help to diversify your training. So for those that want to do the MD, MPH, this is great because now you're getting this really great public health training that you don't necessarily have when you go to medical school. So we see this a lot. A lot of people will combine the MD with the MPH to really get that public health aspect of their training. Doctoral programs are different because usually they're the final step. So they're the stepping stone into a research career, into a clinical career, into a teaching career, academia, industry, and many, many more, obviously. So you would get a PhD if you really love research and you want to take that skill set that you develop and then apply it to a career in a variety of different disciplines. Getting a PhD does not mean you are automatically an academic researcher at an institution. If you have a PhD, you are well equipped to do a variety of different types of careers. So graduate school versus professional school, there's a very large differences. They're not the same. They're very different, and each one is going to offer you different opportunities. So masters can be an extension of your bachelor's. It can be an opportunity to change career paths. They're usually short. A lot of them, silver lining of COVID, a lot of these master's programs are offered virtually or online now, which is great. Gives you the flexibility to continue working, to do more research, whatever you're looking to do, and also get a master's program. Doctoral programs, especially for those of you who are looking at a PhD in the biomedical sciences, you likely already know this, but they're research based. They're training you to be a leader in that field if you wanted to continue research in that field as a career. They take about 4 to 6 years for a biomedical science PhD. And you probably already know this, but you're not paying anything. Competitive programs pay you to be a student here. And that's definitely applicable to our programs. We waive all tuition and fees. We give you a stipend. There's usually healthcare benefits included. Sometimes you have to teach, but not all programs require you to. They're really great opportunities to get those experiences. And then professional programs are practice based. The length that the time it takes to complete these programs, it varies based on the program. I'm sure you all know it could be as little as 2 years. It could be up to 8 years plus until you're actually independently practicing clinician. And they are very expensive usually, and that's the big deterrent for a lot of people is if you're not able to finance your degree, then maybe you start thinking about other options because they are very expensive and tuition just keeps going up, and it's ridiculous. So for a lot of you, especially if you're not sure, for a lot of you who are thinking about MD, PhD, MD, MPH, there's a common theme. You want to help. You want to make a difference in human health. And for if you're anything like me, I assumed that the best way to do that was to become a medical doctor, to become a clinician that saw patients, that treated them for whatever illness they might have had, and that was what you did. A lot of you may not know about the other career paths that are very similar. You can really scratch that itch of wanting to help people, but it doesn't have to be medical school or a PhD. There are a variety of options. And that's what I want to focus on today, is to give you a really nice overview of some of these other options that you may not have considered. I won't go in depth into these career paths, but I just want you to know about them so that if you do have an opportunity to learn more about any of these, you'll seize it, you'll take it. Research and medicine are separate entities, and they do overlap in some key areas. And I think the overlap is where you all are sort of existing, this desire to help, this desire to advance our knowledge of human health and disease. So when you think about a career in just medicine, so if you're just doing the MD, you're treating health issues, you're prescribing medication, you're helping an individual maintain their health, you're improving their quality of life. And all in all, you work with patients for the most part. That's your day to day, and that's what you do. For those of you who are looking at the research side of things, this is, it's a little bit more open-ended. You're making medical discoveries, you're improving treatments, you're improving health, you're, improving how doctors are treating patients, you're moving medicine forward. That's how the PhDs are making that impact. And then you're helping to spread knowledge. So as a PhD, our students travel all over the world to present their research, and so do our faculty. So we're spreading knowledge and we're sharing and collaborating. The PhDs are who inform clinicians. If you're looking at the MD PhD, you already know this. So the research side of things of this career is very critical in helping medicine to move forward. Surprisingly, if you don't know, if you do choose the research path, there are still a variety of ways you can still work with patients. So keep that in mind when you think about careers, that there are opportunities to work with patients throughout a variety of careers, if that's why you wanted to go to medical school. And here's where we overlap: the research and the medicine side. You're helping people, you're providing quality care, you're improving practices, you're understanding human health and disease. This is where that overlap is where, like I said, I think we all sort of exist, right? We like an opportunity to have the best of both worlds. So if you're looking at a career path where, let's say, you want to get the master's and then you want to get into a career that's really, really great, here are some options. And this is not a complete list. This is just a small sampling of career paths that you could pursue. So master's degrees, especially now, healthcare administration is huge. Basically, you're running a center, a health center, or you're helping to run a health center. You're leading, you're managing the system, the professionals who work there. For those of you who are thinking about your priorities, if money was high on your list, and I'm sure for a lot of you, it obviously is up there because you do need to make a living wage to exist and to, actually pay your bills. So what I've included is the approximate salary range for a lot of these career paths, just to give you an idea of what somebody who is in this career could make as a salary. And what I want you to notice in these ranges is that for a lot of my friends, when I was pre-med and undergrad, they wanted to be an MD because it paid a lot of money. And I completely understand that. You're making a lot of money. So a lot of people think of it as an investment. You're paying this huge amount of tuition, but in the end, you get this huge paycheck. And in the end, it's worth it. It's not always the case. There are a lot of careers out there that do pay a very nice paycheck that don't involve a huge debt. Something to consider, especially if you're on the fence about medical school, or if your reasons for pursuing medical school are maybe not really in line with what medical schools are looking for. Something to keep in mind. So a healthcare administrator can make between, depending on your level, between $40,000 and up to $120,000 a year, which is not bad. Clinical trials, you see, we're hearing all about COVID research. Clinical trials are what you need to actually put research into in place in a clinic. So if you're looking at clinical trial management or directing clinical trials, you could really do well. We have a lot of clinical trials that happen on our campus. A lot of our coordinators and managers do very well. And basically they work on an academic medical center, and this is what they do. So if you're a coordinator, you're the one who's sort of supervising these trials, you're calling patients, you're following up with them, you're recruiting participants, and so on. A manager is somebody who oversees the coordinators to make sure everything is running smoothly. It's a really nice career path, and it definitely has that 9 to 5 workday that a lot of people look for. And it's a great way to be able to see research in action. You're still you're working with patients, you're still making a difference. It's not a career path that many people will consider. Genetic counseling, I didn't see anybody who wanted to be a genetic counselor. Usually people know at this point that this is what they want to do. But if you're not sure and you're on the fence, genetic counseling is such a cool career. Basically, you're still a healthcare professional, but you're working specifically with patients, with families, to help them understand some of these genetic diseases, disorders that they might be facing, either a family member or themselves. And you're really the communicator, right? You're helping them to understand the jargon and what this all means, and helping them to understand what treatment options they might have, either short term or long term. So you really get that patient care, because that's what they do every single day, is work with patients one on one. If you are creative, and this is a career path that I had considered for myself also, medical illustration is huge, especially now in the digital age. There are so many opportunities to become a medical illustrator. And what I mean by that is you're an artist who works in the clinical and medical field. We need medical illustrators to draw the diagrams in textbooks, to put together these great virtual apps that clinicians and researchers use to really get this 3D look into something like a cell or to the body. Most of the training now for medical school relies heavily on virtual reality platforms. This is the same for dental school, because it's uncommon to get patients in the clinic all the time. Virtual reality is a great way to sort of simulate that. So medical illustrators can really do very well, depending on where you're working. And there are some excellent programs around the country that specifically train you to do this. And like I said, it's not something that people would consider. So if you are creative, if you love drawing, if you love designing, if you love computer graphics, there are definitely ways to combine the medical world and the creative world. I'm not going to go through every single one of these. I'm just sort of highlighting the main ones. Patient advocacy. This is really important, especially now in this age where we're trying to focus on patients and how they're different. How can we treat them based on who they are? And this is where patient advocacy can really come into play. It's working with patients to help understand what they're going through so that you can communicate that back to the clinicians who are treating with them, and vice versa. You're taking that information that the clinicians are offering and you're sort of translating it for those patients themselves. Think about the typical patient. They're not trained in anything medical related. They're not understanding what's happening to them. They're very scared. They're not sure if they're making the right decision. We're talking about a great example of this is vaccines. Our vaccination rate is not as high as it should be because a lot of people just don't understand what it means to be vaccinated and whether or not they're safe. And this is where advocates can really come into play here. It's a trustworthy person who helps people to understand what's happening to them. There's some great patient advocates in cancer centers, for example. This is very common. We see patient advocates for people who are being treated for their different types of cancers, breast cancer, prostate cancer, especially on our campus. A lot of our PhD students will work directly with patient advocates to help them understand the research that they're doing. Science policy is also becoming huge because we need more scientists and deeper thinkers in our government. We need people who can understand the needs in human health and disease and advise on policy that can move this forward so that we can get funding to our researchers and funding for some of these research topics that may not be very popular. They're not the buzzword, right? So science policy is a great path, and there are some very cool opportunities and internships and fellowships in Washington, D.C., in Bethesda, and Maryland to start learning about some of these things. I have a very good friend of mine who went into science policy after her PhD. She was a senior policy advisor for Senator Elizabeth Warren at the time. And it was just amazing hearing her day to day. I was so jealous of what she got to do. It's just such a cool career path. Personalized medicine. This is another popular career path that's popping up. Personalized medicine is, if you think about 23andMe, Ancestry.com, all of these different platforms where you can send in a sample of your saliva and then they give you sort of this really cool readout of your genetics and how you're related to other people. That's sort of the idea that you're thinking of when you're thinking of personalized medicine. We're understanding the person and the differences between every single person to be able to treat them more effectively. And for a lot of people, this is the direction that they want to see medicine go in, that we're not making generalizations about race, about nationality, about sex, and then treating them based on those generalizations. Really understanding the differences between people so that they're getting the appropriate treatments. That's personalized medicine. And obviously there are ways to do that as a clinician, there are ways to do that as a researcher. But then if you did want to work in industry, people who have been trained in personalized medicine will work in those big companies like 23andMe, um, and Ancestry, and they do very well. They basically are a scientist with those companies. So behind the scenes are many scientists who are analyzing all of your information when you send in those saliva samples. Question, how would you recommend getting involved in science policy? That is a great question. So if you did want to get involved in science policy, you could do this with a master's. There are a number of master's programs that will start to introduce you to science policy concepts. We'll get you some internships in some of the government agencies, depending on the state that you're pursuing your degree in. If you love research, that's the route that my very good friend went in. She got her PhD and then she did a fellowship at the NIH that was specifically designed for people who want to go into science policy. So there are pathways already carved out for you if that's the direction that you would like to go. Our graduate students now, because of our proximity to our capital, which is just down the road, about 9 miles away, they actually are very active in science policy just because they want to be. So they have a lot of connections with our legislators downtown. They do presentations to them so that they understand the research that's happening on our campus. There's a whole student group that does a lot of presentations to the community. So it's a really, there's lots of different ways to get involved in this. But if you did want to go as far as the master's, there are ways to get involved in science policy that way by becoming involved, making sure you're choosing the right master's program. And then if you did want to do the PhD route, for a PhD, there are even deeper paths carved out for you, and you would just apply to those fellowships. And Helen, we can always talk more about that if you'd like to know more. I'd be happy to put you in touch with my good friend. She would love to talk to you. So now we're talking about doctorates. So those were master's degrees. There's some really great options just with the master's, and you're talking 1 to 2 years of training, and then you're off in this career. You do not need a doctorate to be very well positioned to get a fantastic career. So with the doctorate, these are the obvious ones. These are the ones that we usually think about. You can be a research scientist. So if you love research and that's what you want to do as a career, there are many opportunities available for you. You become a faculty member, you'll run and direct a research group, you'll write grants, you'll mentor students in a lot of cases, you'll collaborate with other PhDs, MD PhDs, and MDs to drive research forward. A lot of it is teaching. So if you did want to teach at an undergraduate institution, this is the pathway that you probably want to pursue, is getting a PhD in some discipline. The key here, and this is where we talk about that middle ground. I love research, I love medicine. How do I combine the best of both worlds? The key here for research scientists is looking for programs on academic medical centers, programs that live in an environment where you do have the clinical world and you do have the research world all in one place. Anschutz is a great example of that. There are many of them around the country. You're going to want to look for collaboration. So as a PhD, a lot of our students will collaborate with MDs who run labs. They'll collaborate with other students in MD labs to really bring that research project full circle, to look at that whole story of developing a treatment in the lab and applying it to the clinic. And that relies heavily on collaborations. And then you're going to want to look at individual or schools and colleges and programs that have clinical departments. So are you going to be able to work with faculty members who are clinicians to really inform your research? So these are some key things that you want to look for if you're heading this route. Clinician scientist, so this is the MD PhD route that a lot of people are interested in now. So technically you are a faculty member, but you're also a clinician. You're likely going to find yourself working on an academic medical center because, like I said, you're going to have to do the research side and the clinical side. If you do want to do the MD PhD route, you may already know this, but you're not really going to be able to specialize very much. You can specialize in clinical areas, but for a lot of people who want to go into surgery, like you want to be a neurosurgeon, you want to be a cardiologist, it's difficult to straddle those two worlds because you can't really focus too much on one or the other. So a typical day of an MD PhD is you're spending most of your time running your research lab. You're spending very little time in the clinic. And when you are in the clinic, it's for routine things usually. It's not for in-depth patient care where you're spending hours and hours and hours on something like a surgery, for example. So keep that in mind. MD PhDs spend most of their time conducting research. They're running their own lab, similar to a PhD. You're still expected to get grants. You're still expected to mentor students. You might still have teaching responsibilities. So if you're thinking about the MD PhD route, really keep in mind that it's going to be more PhD. That's just the career path for a typical MD PhD. Clinical pharmacy. This is a very popular area. It's something that a lot of pharmacy schools are offering now because people want that clinical aspect to their training. So if you did want to be a pharmacist, but you wanted to be more clinical patient focused, there are now clinical pharmacy tracks in many pharmacy schools. And basically all this is adding to your training opportunities to work with patients more one-on-one. So if you are looking at this route, you're going to want to look for programs that offer you a clinical track or at least an opportunity to get that clinical training. But I think it's a really great option for those of you who are thinking about the PharmD. For those of you who don't know, for PharmDs, you usually don't need a bachelor's. All you need to do is fulfill the prerequisites coursework that the program requires, and then you are eligible to be admitted to the program. Clinician, for those of you who are thinking about just being an MD, you want to be an MD, you want to treat patients, this is what you want your day-to-day to be, that's great. If you do still love research, you don't have to give that up at all. There are many MD programs that will allow you opportunities to still be involved in research. And if that's what you want, make sure you're looking for those programs. So again, the keys are looking for a program that exists on an academic medical center where there's research happening right on campus. You're going to want to look for MD programs that offer research tracks as part of your training, or at least research fellowships that you can get while you're a student at that school. And there are many available. That's where the direction of healthcare is heading. We want to, we want well-informed clinicians. So look for those programs that have research tracks. Okay, so the rest of them, I went through a little bit for the masters. I'm not going to go into them in detail, but basically, if you can get your master's in something, you can basically always get your PhD in it also. And what it does is just, it gives you that extra level of training, so you get that research experience. But then once you complete your degree, it puts you at a higher status basically in your career. So with a PhD, you can now be hired as a director or a dean or an assistant dean, whereas with a master's, you wouldn't necessarily have many of those opportunities. Okay, making the decision. I'm going to come back to the priorities. When you're making your decision, make sure that you're keeping your priorities in mind. I'll give you a really good example of my friend who is an MD PhD. He did his MD PhD training and he got married right before he started medical school. Him and his wife had known each other for a very long time. And they now have 2 young children. And he just now is an independent clinician. So it's taken him 10 years to go from medical school to being an independent clinician who can now start research and start building his portfolio. So he's not quite a faculty yet, but he's almost there. His wife is basically a single parent. He's never there. The MD PhD route is intense. I really stress this for people who are thinking about this because a lot of students I talk to, they like the MD PhD route because it's the best of both worlds. You can get your medical school paid for, which is always great. And I don't think people really understand the demands that an MD PhD has. So it's just something to consider. If you are thinking about the MD PhD route, it is an intense life that you are sort of entering into, at least for those initial 10 years of your training. So thinking about your priorities. If your priority is to have a family, to eventually get married, or to travel, or all these things, it's unlikely that you're going to be able to do those things without sacrificing other things. And that's only really the MD PhD. The MD gives you a little bit more flexibility. The PhD, obviously, you have lots of flexibility. So really, for those of you headed for the MD PhD route, I do not want to deter you at all. It is a fantastic career path, but really think critically about what it means to be an MD PhD and assess whether or not that's something that you want. So again, consider your priorities. What's really important to you? If you're not sure what a career path is going to entail as far as expectations, do your research. Take the time to talk to people. Contact the programs that you're looking at. Ask to be in touch with current students and ask them what they think about the program. How are they feeling? Is it what they expected? Is this a good training environment? What opportunities are they finding are available at that university, at that school, at the program, don't hesitate to really talk to people about what the program is like, what the career path is like. Informational interviews, if you're unfamiliar with these, all these are is reaching out to somebody who is in a career that you're interested in learning more about and just sitting down and asking them some questions. How did they get to where they are? Are they happy? What do they wish they would have done? What has surprised them about this career? Is it what they expected it would be? Get that honest feedback from somebody who is actually in that career. It's so meaningful and it doesn't take much time. I think you'll be surprised to find that a lot of people are very willing to talk about these things with anybody. So a cold email wouldn't phase them. Emailing them saying, "Hey, I would love to learn more about what you do. I'm an undergrad at this school. I'm looking at career paths now and just want to chat." If you do learn about somebody's testimonial, if you hear a testimonial about from somebody who is in a career path, either in person, there's tons of stuff online now, like should I be an XYZ? Should I be a PhD? Should I be an MD? And there's a lot out there from actual PhDs and MDs who will just put it online and say, well, this is what I regret. This is what I wish I would have done. So, easy enough to Google. If you have the opportunities, go to those fairs, graduate program fairs, professional school fairs, go to the career days if you have them offered at your institution or in your community, open houses, either for a program or for a school. Go to those, take advantage of those, because a lot of times they'll have panels of people who are in the field, alumni from the programs, current students, and it's a really easy way to learn more about a lot of programs or opportunities in a short amount of time. It seems silly, but be realistic about your finances. I get a ton of questions about how do I pay for medical school? How do I pay for professional school? And it is a completely valid question. You should be asking yourself this if you are headed down the professional school route. If you are unsure how you're going to pay for your school, make sure you understand that before you apply. Figure out your options. Is it loans? Is it grants? Is it fellowships? Do the programs offer a track that has funding available? That sort of thing. So make sure you're understanding all of that before you even start considering applying for these programs. For a lot of programs, they're going to want to know that you've considered how you're going to pay for your degree. So if you're applying to medical schools, they're going to want to know that you've thought about how you're going to pay for this if you are admitted. So always have something in mind that's realistic for yourself. When in doubt, if you absolutely hate the path that you have chosen, do not be afraid to change course. And this goes back to take your time. Let's say you go into a program after your undergrad, you decide, "Oh my gosh, this is this is not this is not what I want at all." Don't be afraid to just take a step back, adjust, change course. Don't try to stick it out if you're hating it. I know a lot of our current students who do that and they are just unhappy. If they would have just stopped, took a minute to really think about what they wanted when they felt it in the moment, they would have been much better off because it would have allowed them the time to talk to people, figure out what their options were, and then change paths quickly as opposed to putting in years and years and years of their life just miserable. So never be afraid to change course if you are unhappy with what's happening.